everybody. So I'm gonna do a video about diuretics today. What is diuretics? So diuretics are kind of a medication, right? The diuretics are medication. So how and what are we using diuretics for? So so let me start by this. One of the main reasons of having high blood pressure is one of the main reasons, okay, of having high blood pressure is, when the volume inside the blood vessels are increased. There's an increased blood volume in the blood vessel, and each of the molecule in that water content, of the volume is exerting a pressure on the blood vessel wall. So that means, like, more volume, more pressure, more blood pressure. So what is actually blood pressure is doing, it's gonna weaken that wall. Eventually it's gonna have like aneurysms. That means the blood vessel wall is gonna bulge in, and then it's gonna have like injuries in the blood vessel wall. That's gonna cause hemorrhages. So all these things we need to avoid, right? Also, what's gonna happen if there is like high blood volume in blood vessel, it's gonna affect heart, because now heart has to pump a lot more volume. So heart needs to be work more harder, so it's gonna weaken heart. And eventually the left side of the heart, where is the pumping of the heart, is gonna that side is gonna get weaker. It's gonna enlarge to accompany or accommodate that increased need of pumping and working harder. Okay, after that, after some time, it's gonna enlarge, and it's gonna, like, I'm tired, I'm no more, I cannot work anymore. At that stage, the left side is gonna be, it's failing. That means it cannot no longer pump. It can just fluctuate, you know what I mean? It's not gonna pump, but it can just fluctuate. That means the left side heart is failed. So what if it's just fluctuating? It's gonna pass only a little bit of blood. That's gonna cause the right side of the heart to work harder. Now the fluid is getting backed up to the right side of the heart, right? So the right side is working harder, but eventually it's also gonna be dead. So that in that case, the fluid is gonna build up back up to the veins and the arteries. It's gonna back up to the tissues, and that's gonna cause edema. In that case, and in the high blood pressure case, we need to reduce the volume content in the blood, right? So it's like a circle. It's all connected. It's not just one thing. One thing is gonna cause the other thing, and the other thing is gonna cause some other thing. So it's all connected. It's like a loop. So that's how body works. So first of all, we need to eliminate that excess water content from the blood. So that can cause by increased salt intake as well, because what salt is doing, wherever the salt is, it's gonna pull water in, right? So if the salt in the blood is increased, what is gonna do? It's gonna pull all the water to the blood. Now in that case also, the blood vessel is having increased volume of water, right? So we need to eliminate the water. So that's the priority. After that, we can actually put them in a low salt diet, or something like that, or like a minimum dose of diuretics or something like that we can do. But then now, in the case of like high blood volume in the blood vessel, we need to eliminate that blood volume. That is our first priority. So how do we do that? The kidneys are the thing that is going to help us eliminate the water content, right? So the kidneys need to excrete that water content. So electrolytes are going to help with it. The potassium, chloride, sodium is going to help eliminate and retain the water absorption. So there's going to be 3 types of diuretics. First one is thiazide diuretics. Example, hydrochlorothiazide. There is going to be lot more of thiazide diuretics, but that's the only example that is on top of my head right now. So hydrochlorothiazide is also going to help reduce blood pressure in another way too. It's going to take out the blood volume, the water content. Also, it's going to do something like it's going to relax the blood vessel. But the both are going, when blood vessel relaxes, it's going to have like more space inside that blood vessel. If there is more space inside that blood vessel, the water content, it can hold that water content more like, it can accommodate it. And also the pressure that is going to exert. I don't know if you remember physics. You don't have to remember physics to understand that, but I'm just saying, if you understand physics, if there is like low surface area is more surface area and less water content, what is going to happen? The area that water is exerting pressure is much lower than when it is narrower. You know what I mean? So hydrochlorothiazide relaxes the blood vessel. Now the water level is little bit lower. You know what I mean? So the blood pressure also going to be reduced that way too. Also, uh you know you know so that's how thiazide diuretics works. Now we have loop diuretics. For example, is how furosemide works is like the same way. It's gonna excrete the water content from the loops. The kidney has loops, the nephrons has loops. So from there, it doesn't have to, you don't have to remember that. From there, the water content is gonna get absorbed and then filtered through the kidney, right? So it can so loop diuretics is going to do that. But now the problem is the electrolyte imbalances. It's not just the water that loop diuretics is going to take out. It's going to take out some electrolytes too. For example, potassium. So when a patient is going to be on loop diuretics, we need to monitor the electrolytes. So there is a high chance that potassium is going to go out and then low potassium in the blood. What is going to happen if there is low potassium? Because muscles need potassium, especially cardiac muscles. If they don't have potassium to work, how does that going to help them? How the heart muscles are going to pump the blood? So that then we are in a most dangerous issue, right? So we need to prevent that. So in that case, we switch from loop diuretics such as furosemide to potassium sparing diuretics such as spironolactone. So potassium sparing diuretics means it's gonna save some potassium. It's gonna take off water, but it's gonna retain some potassium too. The problem in that case is like, so after some time, the potassium can build up. If it's gonna build up more than 5.5 6, it's gonna cause arrhythmia. That means now the cardiac muscle is like pumping, it's gonna emits electricity. The SA node is electricity, and it's pumping like very unbalanced way. Now that is a problem too. That can cause arrhythmia, right? So we don't want that too. So when you give diuretics to a patient, we need to monitor the electrolyte levels, we need to monitor the blood pressure, we need because when especially with thiazide diuretics and any diuretics, when the blood volume is going to be excreted through kidneys, the blood volume is going to decrease like in a faster way. That means the blood pressure is going to go low. That means if they stand up all of a sudden, they can fall. You know what I mean? So there's going to be chance for orthostatic hypertension as well. It's going to cause sudden drop in blood pressure. So we need to watch them as like fall risk patients. That also a major concern in giving diuretics. So just keep in mind about the potassium, the electrolytes, the everything, just basically everything I said. So this is just a review, okay? I'm not gonna go elaborate on this because I don't have time. I have 2 kids, so I'm just taking a break from Nclex. But since Vidya is asked, and I just wanted to throw a short glimpse on diuretics. So I hope this is gonna help, and keep this in mind. And also research, you will get more answers and more answers for your questions, and keep asking questions, and that's how you will learn. So please do comment, share this video, like this video, subscribe this video. Also click on that bell button so you won't miss a single video from me. And I'll keep on posting like more interesting videos. I'll work harder for that. Okay, thank you so much for watching.